Working out is a powerful tool for increasing your fertility when you have PCOS. Not only that, it will improve your pregnancy and your journey into early motherhood as well. I'm going to go over the top 5 reasons why it's a good idea to work out if you're trying to conceive or improve your fertility. And I'm also going to give you a few solid tips from someone who's been through the PCOS conception journey all the way through childbirth, and now I got a toddler. I can't even believe that. Okay, so number 1, strength training, cardio, any type of physical activity is going to improve your insulin resistance on some level. And since we know that insulin resistance is intimately connected with the sex hormone imbalances that cause infertility, it's a good idea to incorporate that into your lifestyle if you want to conceive or if you just want less PCOS symptoms in general. In particular, strength training is really valuable. So it lowers androgens, testosterone in women with PCOS, and it lowers another hormone called the anti-Müllerian hormone. And when you have high levels of anti-Müllerian hormone, it's correlated with infertility in women with or without PCOS. And so they find that women who have a tougher time conceiving usually have higher levels of this hormone, but women who strength train on a regular basis tend to have lower levels of both testosterone, which we know gets in the way of healthy sex hormone balances for women with PCOS, and anti-Müllerian hormone, which seems to get in the way of having a child as well. The other big bonus is it increases your sex drive, and you are going to have sex in order to have a baby, right? So you might as well be excited about doing it. So a low sex drive is something that you struggle with. PCOS, that tends to be kind of like you either have a really high sex drive or a really low one. It seems to be the complaints I hear. But exercise will boost your body confidence and actually boost your sex drive in and of itself. And then the final reason is that fit moms have healthier babies. Yay! And faster labor. Can I get an amen? Let me tell you don't want to stretch that journey out, the birthing process, more than is necessary. So exercise will help you be more likely to have a low intervention birth, so less complications, less need for intervention. Maybe you won't feel like you need an epidural. Maybe you won't need a C-section. There's a chance that exercise will help. That's what the studies say. Okay, so now here are my tips for women who want to use exercise as a tool to improve their fertility. Number 1 is to keep your program moderate. If you do too much exercise, pretty much like if you don't have any days for recovery, you could find yourself getting into a situation where you have amenorrhea, which is so your period has stopped, and not because of your PCOS, but because you are working out too much. Now, this isn't as common as a problem. I don't see this happening a lot, but here's how you know if you're working out too much. You're working out with high intensity every single day. Not the best idea. Stick with 2 to 4 days a week of a planned workout where you're really going after it, you're getting it, you're breaking a sweat. And those other 3 to 4 days, you want to stay physically active, but it should be gentle activities like restorative yoga, going for walks, things of that nature, so that you have time to recover and you don't push yourself into this issue where you're not having periods because of your workout routine. The next tip for you is to start strengthening your upper back, so these muscles between your shoulder blades. When you're pregnant, all this weight comes like into your breasts and into your belly, and you start getting pulled forward, right? And so if this gets tight and weak during your pregnancy, it'll only get worse once your baby is born. I hate to be kind of grouchy about that, but you will be obsessed with your kid and you'll always be in this position looking down at their face because their face will be beautiful. And if you're breastfeeding, you will have to spend even more time kind of hunched over, whether it's while you're pumping breast milk or breastfeeding your baby. You're going to just want to kind of counteract all of the activities that you're doing this way by strengthening those muscles back here. All right, my next tip is to combine HIIT workouts, which I will link to in the description below my video about HIIT and PCOS. It's great for balancing hormones. HIIT is a type of cardio, high intensity interval training. And what I think is a nice combination is to do about 10-15 minutes of HIIT and then chill out with a nice walk. Walking is just a great, especially if you're doing it outdoors, it's a great stress reducer. So it'll increase your physical activity, which will help with your fertility. And the stress reduction will be helpful as well, because if you're like really in the throes of a fertility journey, you need probably all of like the stress management tools you can get. And my final tip is to plan your workouts to enhance your own circadian rhythms. So what I mean by that is using exercise as a way to encourage you to get good sleep at night and wake up at a regular time. And you want to do this because sleep and having a normal sleep schedule actually will have a pretty big impact on your fertility and your hormones. So you can do this by setting a schedule where you do your high intensity strength training, your HIIT, in the morning. You might have to wake up earlier in order to make that happen. So 2 to 4 days a week, you're doing your planned higher intensity exercise in the morning. And then the other days of the week, when you're doing that more relaxed, mellowing sort of physical activity, like a maybe gentle yoga or walking or dance, if you're a dancer, you want to go ahead and take that and put it in your afternoon as a way to help you unwind and get ready for sleep maybe in a few hours. So kind of blowing off steam, if you will. And that seems to work really nicely at enhancing good sleep. And good sleep is kind of one of those foundational things that improves every aspect of health, especially fertility. So I know you have a lot on your plate if you're trying to have a baby and you have PCOS and you have a lot to think about. But exercise is really a no-brainer for you and your family. Fit mamas are happy mamas that feel like they can rise to the challenge of early motherhood. They have easier pregnancies, and in a lot of cases, at least in my coaching practice, working out has been instrumental in also fertility. And there's research to back that up. So go forth and do the best you can with making a PCOS-friendly workout for your fertility journey.